One of the most underestimated risks of dietary supplements is their potential to dangerously interact with prescription medications. While supplements are often marketed as gentle, natural, or even complementary to modern medicine, they can in fact interfere with drug metabolism, blood clotting, heart rhythm, and liver function in ways that are not only counterproductive, but sometimes life-threatening. These interactions often go unnoticed until side effects occur because supplement use is rarely disclosed to healthcare providers and supplement labels almost never carry adequate warnings. A major category of concern involves supplements that affect blood coagulation. Many popular products, including garlic, ginger, ginkgo biloba, turmeric, and fish oil, have natural blood-thinning properties. When taken in combination with anticoagulant medications like warfarin, clopidogrel, or even aspirin, they can increase the risk of bruising, internal bleeding, and hemorrhagic stroke. This interaction can be especially dangerous before surgery or dental work, when excessive bleeding can turn routine procedures into emergencies. What makes this risk even more troubling is that these supplements are often taken without any consideration of timing, dosage, or medical necessity, simply because they are thought to be good for circulation. Green tea extract, widely used for its antioxidant and weight loss properties, can also interfere with anticoagulants. Though the tea itself in moderate amounts is usually safe, concentrated green tea catechins like EGCG can both reduce and amplify the effects of certain drugs, depending on the context. In individuals taking blood thinners, green tea can reduce warfarin's effectiveness, potentially leading to clot formation. Simultaneously, its high-dose catechins may increase liver enzyme activity, altering the metabolism of other drugs in unpredictable ways. These conflicting pathways make the supplement's effects difficult to manage and easy to overlook until it's too late. Supplements that affect heart rate and blood pressure represent another class of problematic interactions. Stimulant-like herbs such as bitter orange, synephrine, yohimbine, guarana, and excessive caffeine-containing products can raise heart rate and blood pressure, which is particularly dangerous in individuals taking antihypertensive medications, beta blockers, or antiarrhythmics. These interactions can cancel out the effects of the prescribed medications or cause cardiac side effects such as palpitations, arrhythmias, or even cardiac arrest in extreme cases. Despite these risks, many pre-workout formulas and fat-burning supplements contain these compounds, often in unlabeled or undisclosed amounts. St. John's wort, a popular herbal remedy for mild depression, is a well-known and particularly dangerous example of supplement-drug interaction. It induces several liver enzymes, especially CYP3A4, which accelerates the breakdown of many medications, including birth control pills, statins, HIV medications, immunosuppressants used after organ transplants, and some chemotherapy agents. By reducing the blood levels of these drugs, St. John's wort can effectively render them useless, leading to contraceptive failure, organ rejection, or cancer progression, all without the user realizing the cause. Piperine, the black pepper extract often added to turmeric supplements to increase curcumin absorption, also disrupts drug metabolism by inhibiting enzymes in the liver and intestines. This may boost the effects and toxicity of medications such as phenytoin, an anti-seizure drug, propranolol, a beta blocker, or theophylline, a bronchodilator. In these cases, what begins as a seemingly harmless effort to increase bioavailability can result in dangerously high drug levels, especially when taken over time without monitoring. Even mineral and vitamin supplements can present risks. Calcium supplements can interfere with the absorption of certain antibiotics like tetracycline and ciprofloxacin, reducing their effectiveness. Magnesium can interact with diuretics and muscle relaxants. Potassium supplements, if taken along with ACE inhibitors or potassium-sparing diuretics, can cause hyperkalemia, a potentially fatal condition that disrupts the electrical activity of the heart. The cumulative danger increases when people take multiple supplements, often from different brands, without realizing that the ingredients overlap or compound each other's effects. A person may be taking turmeric for inflammation, ginkgo for memory, and a multivitamin with fish oil, all while on a prescription anticoagulant. This combination could silently push the individual into a dangerous bleeding risk, with no symptoms until a crisis occurs. Part of the problem is that many users do not tell their doctors about the supplements they take, either because they assume they are irrelevant or because they fear disapproval. Unfortunately, this leaves clinicians in the dark about possible interactions. Most physicians are trained to ask about prescription drugs, but may not dig into over-the-counter or herbal product use unless prompted. This communication gap is one of the biggest preventable causes of adverse events. Unlike prescription medications, supplements are not required to carry standardized interaction warnings. Some may include vague statements like, consult your doctor, but very few provide specific alerts about known drug supplement risks. This lack of labeling transparency shifts the burden of research entirely to the consumer, who may not have access to the necessary scientific or clinical knowledge to make safe decisions. To avoid harmful interactions, it's crucial to treat supplements with the same caution as pharmaceuticals. Before starting any new product, especially if you're taking prescription medications, consult with a physician or pharmacist. Keep an up-to-date list of everything you take, including supplements, and share it at all medical appointments. Be wary of stacking multiple products that may contain overlapping ingredients like turmeric, green tea extract, or stimulant herbs. Pay close attention to changes in how you feel, particularly new symptoms like fatigue, bleeding, heart palpitations, or mental fog, which may signal an emerging interaction. Supplement use can support health in certain contexts, but it should never bypass the safety protocols we apply to medications. The human body does not distinguish between natural and synthetic. It responds only to the chemistry involved. And when those chemicals interfere with prescribed drugs, the consequences can be severe. The safest path is one of informed, cautious integration, not blind trust in what seems natural or harmless. Because even well-meaning supplements, when mixed with medication, can become a silent threat to your health.